Well, we are seeing COVID rates increase across the country and across here in Bexar County. It's not just positivity rates growing, it's also hospital beds filling up faster than we can anticipate.
So joining us in today's Leading SA segment is Dr. Robert Leverance with UT Health San Antonio. Thank you so much, Dr. Leverance, for making time for us this morning.
Hey, thanks for having me.
First and foremost, give us an inside look. What does the hospital look like right now, and what % of the patients that you're seeing are vaccinated?
Yeah, Max, great question. Things are already very busy in our hospitals. 97% of the patients in the hospital admitted for COVID are unvaccinated patients. You know, the staff, they're very committed, but you know, this is their fourth round with this surge. And so I'd have to say they're tired too, and a little bit concerned that if people come in either for COVID or for some other reason, they may not be able to get the care that they hope for just due to delays from the crowding that's in the hospital.
And speaking of vaccinations, in your opinion, what percentage of the population should be vaccinated in order to prevent another variant like Delta from causing another outbreak?
Again, great question. The Delta is a bit of a game changer. It's a different biology. As you know, it's much more infectious than the original Alpha variant is. And so before we felt that we needed, a 75% community immunity to get control of this virus. Now, with the increased infectivity of Delta, it looks like it's more like 90% of the community needs to be immune, which means essentially needs the vaccine. So we still certainly have our work cut out for us.
The Israeli Health Ministry recently approved a third booster shot that would be given to 60-year-olds and those who are higher risk patients. Is this something that we could see done here in the United States with the rise of the Delta variant? And is that booster shot, is that a special shot, or is that just another dose of the second one?
Yeah, it's just another dose of the second one. At least that's what Israel is likely doing. Again, a great question. There is some evidence that a booster shot, particularly for those with weakened immune systems, could confer some benefit. However, neither the CDC nor the FDA or the World Health Organization are endorsing this right now, mostly because we still have our work cut out for us in getting people the first shot. And the concern is that if we turn our attention to giving boosters to people who have already been vaccinated, the opportunity cost is that we're not going to get up to that 90% community prevalence. So it's a tough situation. I think ultimately we will approve, the CDC and the FDA will approve a third vaccine. They're just not ready to do that yet.
And so we know a lot of people are frustrated asking, why do I need to wear a mask if I'm vaccinated? Can you please explain?
Well, you know, if anybody had any doubt that we need to use the tools to get control of this virus, the tools being masking and the vaccination. If anyone had any doubt that this was needed to overcome this virus, I think this fourth surge is proving that right now. And that is, we're going to continue on this roller coaster until we get control. Ultimately, the control is going to be due to the vaccine, but in the short period, wearing masks, as I mentioned, people who have been vaccinated can get COVID. Fortunately, it should be a very mild case. In fact, so mild that our concern is that many vaccinated people are acting as vectors of infection, and they're infecting other people, particularly those who have not been vaccinated, and they don't even know it. So it really is important that we all wear a mask. We strongly encourage wearing a mask at the Health Science Center for all of our employees, whether vaccinated or not. And I would say any indoor venue, people should be wearing masks when they're gathering.
And speaking of gathering, we know the school year is starting up in just a couple weeks. What are your thoughts, your opinion on masks in schools for children?
Yeah, same thing there. I mean, this is my personal opinion, but one other thing that we know about this Delta virus is it tends to produce, not only is it a bit more infectious, it tends to produce a little bit more severe disease, and more so in younger individuals. We're still not seeing it frequently in children, but we're definitely seeing it in younger adults. Those are the ones that are filling the hospital. So I would say it's just prudent for our students, our children, to be wearing masks as well inside gatherings, i.e. in our schools.
Well, Dr. Leverance, thank you so much for your time again this morning. And for our viewers, if you want to rewatch or see this full interview, you can find it later on our website at ksat.com. Thank you, Doctor.
Thank you.